community health project, we chose Wayne County, North Carolina. Wayne County is in the coastal plains region of North Carolina. The county seat of Wayne County is Goldsboro, which is the city we chose to focus on within the county. As of 2020, the approximate population of Wayne County was 123,131 people. Wayne County is nearly half and half between males and females with a median age of 37. Over 50% of Wayne County's population is Caucasian, with 32% being African American, 11% being Hispanic, and the remaining 2% being other non-Hispanic races. These first two pictures are the main hospital in Goldsboro, UNC Health at Wayne. The picture on the bottom is the health department in Goldsboro, and the picture in the top right corner is the Salvation Army in Goldsboro. Throughout the remainder of the presentation, there are more pictures from the community as it relates to the topics being talked about at that time. The two vulnerable populations that we chose were ethnic minorities and the economically disadvantaged. Wayne County is home to a large number of minorities, accounting for 37% of the total population, which ranks higher than the North Carolina percentage of minorities. This figure from the 2018 Community Health Needs Assessment of Wayne County shows the percentages of various races and ethnicities within Wayne County in comparison to that of North Carolina, as well as the Eastern North Carolina region, which is comprised of 33 counties in Eastern North Carolina. As you can see, minority races and ethnicities are more prevalent within Wayne County than the state's average. Wayne County is also home to a large percentage of individuals living in poverty. 21.8% of Wayne County's population is living below the poverty level, which greatly outnumbers North Carolina's percentage of 16.8%. In addition to this, nearly a quarter of Wayne County's population receives Medicaid insurance, and 29.8% are legally disabled. This figure shows the percentage of individuals living below the poverty level in Wayne County, the state and Eastern North Carolina region. As you can see, Wayne County outnumbers both of those. So, why did we choose these two populations? First, there is an obvious disparity among African American diabetics living in Wayne County. As seen in this first image, the death rate for diabetic African American males and females is greatly higher than the death rate for the diabetic Caucasians. The second image shows how Wayne County lines up against the state and nation in reference to the Medicare population, adult population, and death rates due to diabetes. Unfortunately, Wayne County exceeds both the state and national percentage in all three categories. Second, as previously mentioned, there is a large percentage of individuals living below the poverty level in Wayne County. In addition to this high percentage, Wayne County also has a high percentage of individuals only receiving their health care through Medicaid, Medicare, or military health care. Wayne County has more than 5% more individuals solely on Medicaid than the state's percentage. Moving on to our community assessment, our first part was the windshield survey. In our completion of the windshield survey, we saw many buildings and housing developments. Many of the buildings within Goldsboro are older, but they are well maintained. Neighborhoods are often named with a sign at the entrance of the development, and there are many sub-communities within Goldsboro that are named but not labeled on maps, such as Rosewood, Parkstown, and Shines Crossroad. There is a fair amount of Section 8 housing throughout the community, as well as single-family dwellings in duplexes or in large apartment buildings. Relatively, Goldsboro is a clean area. There are county workers that maintain office fronts and lawns, and there are street cleaning and trash pickup services. There is, however, a lack of public parks and recreational facilities. There are only 3 major parks, with the safest, most frequented being Herman Park. Herman Park has tennis courts and a large open playground. There's also Stony Creek Park, which is the one in the middle there, that has walking paths, a playground, and frisbee golf. But it often floods, and many of the walking paths go far back into the woods, which leave many community members feeling uneasy. And lastly, there's Berkeley Park. Berkeley Park has a large homeless community as well as a fair amount of drug use, which deters many of the community from visiting. Public transportation options. The public transportation system was established within the last 10 years in Goldsboro. However, many people still rely on personal vehicles for travel. These are 2 of the bus stops within the community. Roads, streets, and highways are well maintained and in fair condition. However, there are little to no sidewalks for walking and exercise. There are several grocery store options as well as pharmacies. And as far as diversity goes among the community, It is a middle-class working town. It's likely heavily Republican or conservative, with several vote for Trump signs across the community. It is a mix of ethnic groups, however, it is predominantly Caucasian, and different areas of the community are home to various ethnic groups. For example, Mount Olive has a very large Haitian population, and there is a large Hispanic population due to the jobs offered at Smithfield Packing, Case Farms, Mount Olive Pickle, and Butterball. Our informant interview was with Karen Newcomb, who is the case manager at UNC Health Wayne. Ms. Newcomb spoke on her day-to-day tasks in regards to caring for her patients within the community. She works with all team members of the treatment team. She helps identify and examines the needs of patients that are hospitalized at UNC Health Wayne and provides resources to those patients, especially those who may not be able to afford medications or materials to care for themselves after discharge or other health management items. Ms. Newcomb is also integral in referring patients to the WATCH program. WATCH is the Wayne Action Team for Community Health. The mission of WATCH is to provide primary and acute care to those who are uninsured in Wayne County. There are 3 family nurse practitioners who serve as providers with WATCH: Kelly Corbett, Hilda Atik, and Brandon Godwin. WATCH provides many services, including healthcare access, assistance with obtaining prescriptions, and providing referrals when there are needs outside of the care they can provide. There are 3 clinics with WATCH. One is at UNC Health Wayne behind the emergency department. One is at the Goldsboro Family YMCA, and then they also have a mobile unit that travels across the community. Since opening, WATCH has completed over 167,000 patient visits and treated over 15,000 registered patients. And some quality improvement goals of WATCH, they complete annual foot screening for diabetic patients that is in line with the American Diabetes Association's guidelines. They also do A1C checks every 3 months until A1C is controlled, and then they check every 6 months. They also complete yearly microalbumin tests to preserve kidney function, and they do annual retinal scans for diabetics that are 30 and older. So with that, the 2 top health issues we noted in Wayne County were diabetes and heart disease. There are multiple community strengths. However, the 3 we picked were that there are multiple resources for healthcare access. Wayne County offers several healthcare opportunities for its community. With just a quick glance on Wayne County Health Department's website, it's obvious that several programs are offered to the citizens. Listed here are several services and programs offered through Wayne County's Health Department. Strangely enough, despite a large presence of individuals covered by Medicaid, 85.3% of Wayne County's population had some type of health insurance. This is only slightly below the state's percentage of 87.8%. Also, public transportation. There are several public transportation options available for the citizens of Wayne County. Wayne County is also very close to several highways and interstates, which makes travel convenient and easy. There are 2 private airports within the county, and Raleigh-Durham International Airport is only an hour and a half away. 3 weaknesses to Wayne County. The first we said was food insecurity. 56.5% of households in Wayne County receive the Supplemental Nutrition Assistance Program, also known as SNAP, which provides low-income families means of purchasing food. Wayne County's percentage was almost 4% higher than the state's percentage. Poverty is also a weakness, with almost 22% of the population living below the poverty level. Poverty is a great weakness for Wayne County. In conjunction with the elevated poverty percentage, almost a quarter of the population receives Medicaid benefits. And lack of access to physical fitness areas, kind of piggybacking off the weakness of poverty. The low income for many members of the community could be a deterrent to gyms that require membership. Gym memberships typically come with a monthly fee, and if individuals are hard-pressed for finances, having a gym membership would be the least of their priorities. Safety is another issue as it relates to fitness areas. As mentioned earlier, 2 of the 3 parks within the community do not appear to be the safest location for many individuals, which leads them to typically be avoided. Here I've included some of the exercise facilities that are available. There is a Planet Fitness, there's a CrossFit gym, and then the Peggy Seeger Senior Center is a center that the seniors can go to and do some exercise and classes like that. With all of this information, we have created 2 nursing diagnoses based off of the population. One identified health issue in Wayne County is diabetes. Notable contributing factors include being overweight, lack of exercise, lack of healthy foods and nutrition. So the diagnosis we have for this is deficient knowledge of disease processes related to inadequate knowledge of community support and resources as evidenced by increased incidence of physiological condition. 40% of adults over the age of 20 in Wayne County had a BMI greater than 30, which exceeds the state's rate of 32%. Wayne County's health department and the YMCA provide free diabetes prevention classes to the community. However, they are not readily known about. The lack of safe sidewalks, parks, and recreation is another barrier to diabetes management and prevention. While gyms and the YMCA are options for exercising, many individuals express concern regarding affording membership. And lack of proper nutrition likely stems from a knowledge deficit as how to eat. Several community-based organizations distribute food throughout the community. However, these events are also not readily known about. Our other diagnosis is ineffective tissue perfusion related to coronary heart disease as evidenced by atherosclerosis. Believe it or not, one of the biggest risk factors for coronary heart disease is diabetes. And the 3 contributing factors for diabetes can also be placed as factors for heart disease and reasonings as to why it's so prevalent. With these 2 diagnoses, we have proposed 3 interventions for each diagnosis. For the deficient knowledge diagnosis, our primary intervention is that the community health nurse will provide information related to educational opportunities in the community as it relates to diabetes, exercise, and nutrition via brochures and handouts, as well as collaborating with the community to advertise on a mass media platform such as billboards, radio, and TV commercials. Our second intervention is that the nurse will identify at-risk individuals in the community and adhere to necessary screening recommendation processes such as an annual or semi-annual A1C and glucose level checks. Thirdly, our nurse will educate diagnosed members of the community regarding daily glucose monitoring, as well as proper use of diabetic medication and regular foot and eye exams. For ineffective tissue perfusion, our primary intervention is that the community health nurse will provide patients with education on the risk of heart disease and the increased risk for patients with diabetes. Since we spoke earlier about type 2 diabetes being one of the greatest risk factors for coronary heart disease, education should include proper diet, exercise, and information about programs in the community that would offer support. Secondary, the nurse will identify at-risk patients and encourage proper screening for disease to catch it as early as possible. Screening could include coronary angiographies. And our tertiary intervention is that the nurse will monitor for compliance with medications for disease as well as diet recommendations such as low salt and monitoring fluid intake and output, as well as daily weight monitoring. The nurse will also reinforce education on how medications can help manage the disease and the importance of dietary compliance. Wrapping it all up, this project really opened our eyes as to what the role of the community health nurse entails. Public health nurses are a vital part of the health of our community, and this project helped us to gain more of an understanding of the care that the community health nurse provides, and encouraged us to take initiative in helping provide care for the community around us. So with that, we just want to thank you for watching our presentation, and we have included our references here. Thanks.